Good evening, ladies and gentlemen. I would like to extend a very warm welcome to all of you for being with us today. My name is Julia Paivina, a Semester 2 Foundation student of IOMW, and I'll be your MC for this session. We appreciate you taking time of your busy schedules to join us today, and we hope you'll find this event fruitful and engaging. The webinar today is an initiative taken by IOMW's Foundation students to share information on scientific files that are interesting, relevant, and should definitely be talked more about. With us today are two distinguished guests, Dr. Chu Xingying from the National University of Malaysia, or UKM, and Dr. Saravana from the Chemistry Department of Malaysia. Both sessions will be moderated by one of our lecturer of IOMW, Mr. Aminuddin Baharuddin. Dr. Chu's talk today is titled, What are the speech disorders and what can we do about it? Without further ado, I will pass the session to Mr. Aminuddin.
Thank you, Yulia. So good evening, everyone. So welcome to the final session of the CFS Dialogue webinar series. And today we have with us two prestigious speakers. And for the first session, we'll have Dr. Chu. And for the second session, we'll have Dr. Saravana. So without further ado, I would like to invite Dr. Chu on the screen.
Hello, everyone. Good afternoon.
Hello, Dr. Chu. Good afternoon to you too. Thank you so much. How's your day, Dr. Chu? How have you been?
Pretty good. It's raining here. So I hope the internet will work very well.
Hopefully. Oh, it's raining over there. Over
Yes.
here, it's still quite sunny. Still very sunny indeed.
Great.
So, Doctor, if I were to describe your background or your history, I would need easily 30 minutes because you have educational experience from Kansas, USA to Japan, research with Australia and in Malaysia. So it would be much better for you to give us a brief introduction about yourself and what you're working on right now.
Yeah. Actually, my name is Dr. Chu. I'm now working as a senior lecturer at the University of UKM, University Kebangsaan Malaysia. So our main campus is at Bangi, but for speech program is actually located at Jalan Temerloh, nearby the GH Hospital. We have a clinic right there. It's called the Audiology and Speech Clinic that we see patients ranging from kids to adults. And my background is actually I did my undergraduate in University of Kansas in psychology. And like many of you guys, when I finished my SPM, I wonder what should I be, and I chose to be a psychiatrist. So I went ahead and get a psychology degree, and very soon I realized that I'm not very keen to work with patients who have mental health, and so it actually lead me into a speech pathology or speech sharing disorders when I finished my undergraduate, and I got a scholarship from the university, and that's when I extended my research path from a more clinical setup to a master degree, which is a clinical professional certified speech pathologist, and then I moved towards to research. That you will see a slide later and how it actually evolved later soon.
Okay, great. So I think we can start with your talk. Since we have in the chat, some of us are very, very excited to hear your topic.
All right, let me share my screen right now. Okay, can you see that? Is it good?
According to the comment, there's nothing presented yet on the screen. It might take some time to load. That's normal.
Oh, okay. It's not sharing.
Okay, let me try sharing something.
Can you see the first screen? Oh, yep.
No, Doctor.
Yep, it is. It does take a little bit of time to refresh it.
Okay, great.
Now, got it? All right.
Yes,
All
perfect.
right. Today we're going to talk about what are speech disorders and what can we do about it. And I'm going to provide you some of the current perspective of in Malaysia setup. And like I said just now, I was like you guys when I finished my SPM. I was sitting there trying to think whether I should become a doctor, I should become a nurse, should I become a lawyer, a teacher, a social worker, or should I just get someone and just get married and don't do anything? But there's not other options. So I went into psychology, and then until I saw this message where it comes across my mind, and decided to go into speech therapist professional. So the term this the phrases communication is essential for humanity to acknowledge, to express our thoughts, our feeling, and it allowed us to be able to participate within a society. It has a lot of impact to me because the first time I realized how important communication is for a human being. So this is actually make us a human being when we talk about communicating, because we use word, sentences, phrases, and it always when we talk about communications, it involves two components, the speaker and the listener. So if I want to say something and I say good morning, good afternoon, and you as the listener, you process it and then you feedback, and of course you say good morning or good afternoon back to me. For in a certain way, for example, if I'm saying another language, for example, Japanese, I'll say Ohayo gozaimasu. If you have no experience with Japanese language at all, you will not be able to understand, and there is no feedback. And when there's no feedback, these closed loop communications will fall down. So when we talk about communications, we usually put them in as production and perception, because the talker needs to produce certain speech while the listener needs to perceive and understand and feedback and talk to the speaker or the talker. So the idea is like this, and I put it in a very simple drawing for you guys here, that we first think and we process in our brain what we want to talk, and then we move our vocal fold together along with our respiratory system, our vocal fold, our articulator, or our tongue, our lip, and we process and let the sound wave come out, and it will go to the listener's ear. The listener will perceive and go back to their brain to be able to comprehend the speech. So this is how communication works. But what if you have hearing impairment as a listener? Then the loop will break down. What if you have a stroke and you're not being able to talk smoothly and fluently like what I'm producing right now? So the communication will break down again. So at this case, what should you do as a speaker or as a listener? What professional should you go to seek help for? The professionals that you need to go is either your family doctors or the speech language pathologist if you have encountered those situations. So whenever we're talking about communication disorders, we usually put them into two big umbrellas, which is speech disorders and language disorders. The definition for speech disorders is actually an impairment of articulation with speech sounds, the fluency of speech, or the voice. So right now I'm talking fluently and I'm using a smooth voice, soft voice for you when I'm talking. What if I'm talking like this to you in a breathy voice. So this is not a natural voice. This is what we characterize that person as having a speech disorders or voice disorders. And later I'll give you an example of video of somebody who actually has a fluency disorder, or what we call as individual who stutter. And we also notice that language disorder, it's an impairment in comprehension, being able to understand the usage of a spoken, either speaking or writing system. And communications disorder, on the other hand, is an impairment in trying to receive, sending, and process different types of symbol system. The symbol system here could be spoken language, it could be written format, it could be icon. So you might wonder what can cause speech disorders. These are some of the common causes that we see in clinic and also in research, and that could cause speech disorders such as brain damage, degenerative disorders such as Parkinson's disease. If you have respiratory weakness, you might have low respiratory systems to support your speech, and so you might have breathy speech. That would be one kind of speech disorder. If you have stroke or vocal cord damage, if you shout too much, for example, then you run out of voice, the voice become very hoarse, or maybe sometimes if you have a cold, a very bad cold or flu, then you might have a voice disorder at that point. If we also see speech disorders co-occurring together with dementia. And when someone actually has speech disorders, it actually, we refer them as, they produce unclear speech or unintelligible speech. And they also tend to have reduced voice quality. They become more hoarseness, or the voice become more breathiness. And this will actually have an impact on their social networking. So they might reduce their social network, they might withdraw from their friends, they might go not being able to perform at their workplace. So all the speech disorder could have an impact on their social life. So let's try watch the video. I hope the video actually works. This is a person who has stuttering, a severe stutterer.
I see a older couple lounging on the beach, and overhead is a coconut tree, and one coconut nut is falling, ready to land on the older guy's head. That's what I see in the picture.
Okay, can you stop the video? Actually, the person is trying to describe a picture, and this is what he said. Without showing this, I'm sure most of you guys have no idea what he was trying to say, unless the last sentence. That's what I see in the picture. This is a severe case of a person who has stuttering, or you can see that he has a lot of extra movement on his face, and this is a main characteristic that we see in the clinic setting of a severe level of a person who has stutter. And also his speech is not fluent like what we are talking right now, right? I hope you heard that. And so when someone actually have that issues, they really need to come and see us as the speech therapist, so that we could get some help for them. So that leads us to another question. Who are speech therapists? So in Malaysia, we refer ourselves as speech therapists. And it actually, in United States, in Australia, we are also referring ourselves to speech language pathologists or speech language therapists because we treat speech, we treat language, and we diagnose. And hence, we have the term pathologies here. So our main role is to evaluate or to diagnose speech, language, communication, and swallowing disorders. We also treat these disorders, and we provide training and educations to the families and caregivers, and also to other professionals such as nurses, teachers, social workers, and hence we work collaboratively with a lot of different professionals. For example, physiotherapists, occupational therapists, teachers, and nurses. Um, so, as a speech therapist, we populations that we serve across lifespans, from little premature infants to elderly. So these are the populations that we see the most is the neurological disorders populations, those who have autism spectrum. This is quite common in Malaysia, and Parkinson's disease patients, cerebral palsy patients, and those who have speech delay patients. This will refer to young kids at around age 3 to 7 years old. Structural disorders such as cleft palate kids and hearing impaired kids, and those who have stroke, dementia, or traumatic brain injury are another populations that we serve. And my research interest in stuttering, so I see patients with stuttering, and we also deal with swallowing issues with premature infants and also with stroke patients. So what we do in a clinical setting, it's just like you see in this picture, we are trying to train the patients to be able to produce accurate sounds. So we have different type of exercises and different types of speech modification strategies that we train, that we can teach the patients or the caregiver to produce accurate sounds. We also train patients to learn social skills such as how you're going to respond appropriately, how you're going to increase your confidence, the way you answer questions, and how to do topic maintenance when you're having a communications. So this learning social skills is more towards to kids with autism spectrum disorders and adults with stroke or TBI patients. And if normal speech conversations skills are not being able to handle by the patients, certain group of patients, we might train the patients to use AAC, such as a handphone, an iPad, line drawings, or sign language, or gesture, or even finger spelling. So our main goal is to help them to be able to communicate very effectively with others people, so that they can function better in the society. So as you are not a trained speech therapist, and here are some tips for you to when you encounter somebody who has communication disorders or speech disorders, you can always request them to repeat the sentence politely. Say, "Excuse me, can you repeat the sentence one more time, please?" And you can just wait while they're talking and don't interrupt them when they're trying to finish the sentence. Then simplify your questions. Another tips that I really like it is to be honest to the loved one, to be honest to the speaker if you're unable to understand the speech. Don't just knock your head or shake your head like this. Just be honest and be upfront. Tell them, "I don't understand. Please repeat." Or if cannot, if they don't really understand you, you can use a pen and a pencil, or use gesture, your facial expressions, or sometimes I will even ask the caregiver, use the handphone or use the symbol to get the communications expressed, to get the thoughts expressed out. So if you are interested to become a speech therapist, here are some background for you. In Malaysia, we have actually right now we have 3 institutions in Malaysia: UKM, USM, and UKM, USM, and IIUM. that actually produce speech therapies. I put here 2 institutions because at current we have about 300 STs being graduated from UKM and USM. And this is the minimum requirement to practice as a ST or speech therapy in Malaysia. Just a 4 years of degree compared to United States. You need a master degree to become a speech therapist. And in the States, we have 268 institutions. So they have more than 160 certified STs compared to us. So this means that in Malaysia, one speech therapist is serving for around 100,000 people, while in US, about 50 of them serving for 100,000 people. What does this mean? This means that Malaysians needs much more certified speech therapists. Than the US. And with the growing of populations that we have each year, we need more people like you guys to join us as speech therapists. And at current in Malaysia, most of the speech therapists are mainly in the state capitals in Klang Valley and Kuala Lumpur. The caseload that we seen mainly consists of pediatric cases. And this links us to think, at least for me, how I can use my professions and how I can link the research and clinic together. Okay, so I did a study back in 2017, and I realized that in among family with autisms, we realized that a lot of them have late referrals compared to overseas when they were being referred at about a year 18 months old and being diagnosed at around year 2 years old or 2.5 years old. But this is not the case in Malaysia. Because of the late referrals, we have late recognitions or late diagnosis on the autism, which means that the speech therapy services, the OT or the occupational therapy services that they will get will be delayed. So this and so I thought, why is it so late? Is it something wrong with the medical system? Is it maybe because the population is not understanding and not aware of the knowledge or attitudes about speech therapies professions? What is going on? Is it there is a lack of autism and speech language therapies? So this lead us to next studies that we actually asked and wanted to see the awareness and the knowledge among general populations like you or your parents or your friends about speech therapists. So we asked very simple question. You can do it right now. A teacher always talks in a loud voice to her students in class. One day she lost her voice, but it recovered. However, she's now having difficulty when talking aloud and has a harsh voice quality. Should this person being seen by an ST? You can put your answer on the chat box because we have this chat box right there. And then the second situation, this is the real samples that we use in our survey. A 3-year-old child has not started to talk yet. So he is only able to understand simple instructions such as stops and wait and able to recognize his family members. So the parents are worrying that the kid's speech is not developing normally like his older sibling. Should these kids being seen by a speech therapist? Yes or no? You can put your answer at the chat box and I will check back with you later. So we survey in the general populations and we got 535 surveys back, and we realized that when we asked about communication disorders, the general populations, more than 55% of them actually understood what is communication disorders, and they're quite good actually in recognizing the role of speech language profession. So if the general population know the profession of speech language pathologists, why is the referral rate is still low? Is it related to culture? Is it because of stigma or anything like that? So one interesting things that we found is that the healthcare professionals in this in this category, it will be those who are from nurses, those are in physical therapists, those are in medical doctors, are actually they have more positive attitudes and higher knowledge towards communication disorders compared to those general population. So this actually lead us to another study to wonder, is it a stigma issue? Is it a culture issue? Is it a belief that Malaysians are not bringing their kids or their parents to seek for speech therapist help? Why is it not? So we did another study on this study actually focused mainly on ASD, or the autism family, in 110 family who has kids with autism, and we found that they actually do not feel stigma. Affiliate stigma is the stigma that being felt by the person. In this case, they will be the parents of children with autism. They don't feel stigmatized, and their stress and quality of life are at moderate level. They are quite stressed, moderate level compared to the normal population, mainly because of the time demanding tasks they needed to take care of the kids. For example, a lot of them reported they feel stressed because they need to bring the kids to different life health professionals for treatments of that is very time consuming, and that's why causing them feeling stressful. So those are from social science perspective, looking at the impact of communication disorder, impact of speech disorders, trying to understand what is the general population think about speech disorder, what is the general population's think about speech therapy, their awareness of different types of communication disorders. But we also have one challenge in Malaysia's speech therapy field, is that when we are looking at the speech, this is how we are looking at speech. And you can hear from me, actually, we can measure, like you've seen on this computer right here, these are the sound wave. And what is missing here, it's we don't have standardized measurement of speech sciences or normalized or standardized tests that we can use in Malaysia when we talk about speech disorders. So for a general concept, when we talk about speech science, let's look at the production area right here. When we try to produce speech, we need to use our lung or respirations, phonation, which is the vocal fold, and articulation, which is our tongue and our lip to move in order to produce speech. And these are all being produced by the central nervous control system. So now let's have a quick activity. I want you to sit up straight. Now just listen to my instructions, sit up straight, take a deep breath, and now say ah as long as you can. Ready? Sit up straight, take a deep breath, and say ah. Okay, now this is a normal example for you. What if you have a patient who say, sit up straight, take a deep breath, and say ah like this? Ah. Give you a try one more time. Ah. One more time, sit up straight, take a deep breath, say ah. So you can see that I'm demonstrating a patient who have not normal voice quality right here. So by a simple task like this, by saying ah, we can differentiate and discriminate through our ear, of course, by a trained speech therapist, that this is a disorder patient or this is a normal patient. And let's try another task. Now let's say pataka, 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 as fast as you can in 8 seconds. Sit up straight, take a deep breath, say pataka, 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 pataka. So this is another way that we can actually assess our patients using pataka, pataka, pataka. But the main issue is in Malaysia, we don't have a standardized of how many pataka that a person should say in order to discriminate between a patient and a normal healthy adult. So what we did is we create a manual. This is known as the oral DDK assessment for Malaysian Mandarin speaker. We only have the Mandarin manual at this moment, and we are actually developing a Malay manual right now, and it's under copyrighted right now. And what we did is we show them this stimuli, pataka, patakan, butter cake, and this is Mandarin is called patakan, afraid he will see. And we have collected data across different ages from young college students from 20 years old to 80 years old. And then what we found that is the elder people actually will produce less pataka compared to young group of population. And so with that, we can have a table. We can have a table that we can show. The table is actually in this manual that can be used in clinical wise when the speech therapists are doing assessment in the hospital for their patients. And using that, they could refer to the table and tell us whether this patient is within normal category or this patient is not within normal categorizations and the patients need further assessment or not. With that, I end my talks with you today. Thank you.
Okay, thank you so much, Dr. Chu. So I really enjoyed the activity. The whole room was filled with us and patakas for like 8 to 30 seconds. But
Great.
I would like to answer your question. Remember, you showed us a slide which has two questions, yes and no. So if I were to answer, I would say that the first one, which is the teacher with a coarse voice, I would say no, because she could communicate before, but now it's more physical. So there's nothing wrong with her motor skills, ability to communicate. Maybe it's more of a physical sore throat, and she has no problem with communicating. So maybe drinking tons of water and eating strepsils can let her to communicate later in the future.
Yes. Yes.
So I would say
yes.
no for that, but for the first one, I would say yes, because they're still not able to communicate. So the communication hasn't started yet for the child. So that's my answer. Is that correct?
Well, for the second one, the child has not started to talk yet. Yes, the patient needs to go and see a speech therapist. Okay, because at 3 years old, we expect the children being able to have conversations and being able to ask the why questions, why mom questions, to be able to describe the day in the daycare. For the first case, which is the teacher's case, the answer is yes, to be able to yes, because the reason why is because this is a recurrent. And it's because of his professional as a teacher, and teachers tends to shout in front of 35, 45 students in the classroom. They don't use mic that much. So so that actually hurt their vocal cord a lot. So if the teachers feels sore throat in a regular basis, and although it recover after a few days and then it come back and it has harsh voice quality, we'll advise her to come and see a speech therapist for that. So we will treat them as a series of protocol, how to warm up your voice, how to protect your voice when you're teaching, things like that.
So that would still be considered as a speech disorder?
Yes.
For the first one?
Yes, it's a voice disorder, to be more specific.
Yeah. So during my master's, I did a short side research on clinical depression. What I saw was that people who think that they know what depression is most probably not depressed. Just like it's just being sad, it's just going through a phase. Being
Mm.
sad and clinical depression are two totally different things,
Yeah.
and that would lead me to speech disorder. Sometimes
Mm-hmm.
growing up, I do have problem with stuttering
Mm-hmm.
and stammering. But as I
Mm-hmm.
grow older, I tend to control my delivery. I speak slower. So, what would be considered as being a speech disorder, a clinical speech disorder?
Okay. Uh, the clinical speech, of course, when we are trying to diagnose the speech disorders, we have a series of tests that we use to
Mm,
categorize whether you have certain speech disorders, for example, stuttering. So
mm,
we've said stuttering, we are actually looking at a developmental stuttering, those who are at young age, for example, 4 years old, 5 years old, 6 years old, they start to have stuttering behaviors. And a lot of the kids with training, and sometimes even without training, it will go away. But
true.
some, it actually go together with them until adulthood and until elderly.
Mm,
Okay, so then we also have voice disorders. Those who have, for example, respiratory infections, and the person's respiratory uh, system is not very supportive. Is the lung volume is not strong enough to support the speech production. So that would be one type. And then, for example, you also see some patients cannot say the word L sounds or the R sound, or
mm,
or that is another type of speech disorder as well.
okay. And what was quite surprising in your presentation just now was the amount of speech therapists to patients with speech disorders.
Yes.
And
Mm-hmm.
since your research has been working with people from Japan, from
Mm-hmm,
Australia,
mm-hmm.
US, is there a difference in how all these different countries, their perception on speech disorder? Like for example, do they treat order as being something serious or something? Does Malaysia
Mm.
look at speech disorder different than how Japan treats speech disorder?
Uh, I'll answer the first questions.
Mm.
Does Malaysian speech therapists treat speech differently than others people in the country, other countries? Is
It's
that
more about
what
our perception.
your
The
perceptions,
Malaysian,
the
yeah,
public perceptions,
yeah,
whether the public perceptions towards communication disorders and speech therapist disorders difference compared to the US, Australia, that I
Japan.
cannot answer you because we don't have concrete data to support it. It'd be good if I can extend my research using the same survey and do it in Australia and do it in Japan and do it in other country. Then we can have a better idea for that. Then I can answer you better. But in general, because you look at the history of speech language pathologies, Malaysia, we have about 40 years, 40, 43, 45 years of speech therapists in Malaysia compared to US, which already they are the pioneer. So the speech pathologist has been in the medical field in the society for many, many years, more than 45, more than 60 years. Okay, so of course the awareness will be better because they have more activities about the awareness. The awareness within the populations, within the general public, will be greater compared to us. That I would assume and expect for that. And the other issues is the medical issues, the insurance that in, for example, in United States, if you are going for speech therapy consultations or treatment, you are being covered by your insurance, Medicare. So the insurance will
Mm,
pay for it. But in Malaysia, it's you either go to hospitals, government hospitals, where the government helps to pay a little bit, or you go to private centers where you have to pay out of your own pocket.
yes,
Yeah. So
true.
there's different medical system in that case.
Mm, 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 mm. And
Yeah, and one interesting thing is when I was dealing with parents with autism kids, and I myself think that culture and beliefs and religions actually um, contribute to the belief whether they should accept or they should bring their kids for further assessment, for further therapy or not. Because the more I talk to these parents, the more that they believe that the God actually sent me the kids, and so I should take good care of the kids because this is a challenge that the God actually gave it to me. So because this is a challenge, I should take the challenge. And because of that, it also lead a lot of the parents not to bring their kids for assessment. They were rather to take good care of their own kids. We have a delay.
Yeah. That's a oh, really. Okay, so that's a very beautiful way of looking at it. And, but before I pass the Q&A, last question. So about speech disorder, because when we hear the word birth of diseases, genetic diseases, so about in regards to speech disorder, are they mainly mental because of disorder, or there's also genetics in disorder?
Actually, I can't hear you well. It's cutting off.
Okay, show
Maybe
the
you want to
technical.
type?
Okay, am I back now on the screen? Because the
Yes,
Wi-Fi
yes.
is a bit wonky.
It's okay. You can type.
Okay,
You can
great.
type at
So
the chat.
okay, so meanwhile, I'll just try one more time because the question is
Okay.
a bit lengthy.
Okay, come on.
So before I pass the Q&A to the floor, I have one last question. When we hear the word disorders, we think of like diseases, genetic diseases, inherited diseases. But with regards to speech disorders, is it mainly environmental factors, or is it there is a part of genetics in giving rise to speech disorders?
That will actually go back to whether you have a concomitant disorder. For example, if you have a Down syndrome, for example, so so we will expect that your IQ is not within normal limit. So your language, you will have language disorders because your language is the vocabulary, the language part is being disrupted. So it affect your speech disorders. So at the same time, you have language issue, then you have speech disorders issue, and because of that, for Down syndrome, it is very unique because a lot of them might not have communication disorder because they are very willing to have eye contact. They are very willing to use gestures, and they're very happy to communicate with you. So that your questions is very interesting because this a good questions whether speech disorder is actually being affected by the environmental or is it genetic. So it depends on the disorder or the diagnosis of that person's. So,
Okay.
for example, in another case, let's say I'm a teacher, like the teacher case, and I'm a healthy person. The only medical issues that I have is that I might be a little bit obese, for example, and I have high blood pressure. So that is not really related to your voice disorders in this case. Okay, the voice, the teacher's case is because there is an abusive usage or excessive usage of voice that leading to a harsh voice or losing voice for the teacher. So there is no genetic issues in that case.
Okay.
Okay.
Okay. Thank you so much, Doctor.
Thank
So now, so before we pass the Q&A to the floor, I'll pass to the MC first, Yulia.
So thank you so much to Dr. Chu and Mr. Aminuddin for eye-opening session. That's a great topic that we discussed. And yeah, next will be Q&A session. While we shortlist the question to be forwarded to Dr. Chu, we would like to share with all of you a brief video about IUMW. And we'll get back to you in 3 minutes.
Right, everyone. So apologies for the very chuggy video. The Wi-Fi gods are not with us today. It's quite wonky, but it's fine. Let's go straight to the Q&A session. So since we have around 5 minutes left, we'll take 2 questions. So I'd like to invite Dr. Chu back to the screen. Okay, welcome back, Dr. Chu. So let's
Hi.
get the first question on the screen, please. Sorry for the technical
Oh, don't
difficulties
worry.
we're experiencing.
I can see, actually, I saw the comments right here. Maybe I can read it.
Because we have quite a number of questions.
Yeah, this is a good question. It says, how can a person who has speech disorder can communicate comfortably with other people? That's a very good question. This is from Amy. Um, uh, Communications is actually two ways. Okay, you need a speaker and you need a listener in that case. So I've taught you the tips, that ways that you could help the talkers to become more effectively. But as somebody who has speech disorder, it depends on what type of speech disorders that you have here. So for example, if you have voice difficulties. For example, let me give you the stuttering example. Let's say you know that you have stuttering disorders. And so I can teach you ways to reduce the stuttering. For example, slow down your speech, take a deep breath before you speak, or even try to maintain eye contact is a way to communicate with other people. And using tapping methods when you try to talk, so you will be talking like this. It's not very natural, but for somebody who has severe speech disorder, sometimes we teach them to tap like this so that they have a momentum to speak with other people. Then eventually we will train them to switch without the tapping. Okay, and that's one of the technique that we use to train those who have speech disorders. So it's actually individualized program. We target of what the person needs. So it depends on what type of disorders or what type of weakness and what are your strength. We try to highlight your strength as well if you have a speech disorder.
Okay.
I hope I answered
Thank you,
that
Doctor.
question. Thank you.
Let's take one final question from the floor.
How often does someone with speech disorders overcome it? Good questions. Do you mean overcome in terms of psychological, like accepting the speech disorders, or so there are two different type here. So when we tell the patients, okay, now you are being diagnosed with stuttering, now you have articulatory disorders, or you have you are not being, your child is not being able to produce the L sounds correctly. Okay, so is the person being able to accept it or not? The quicker the person being able to accept the fact, the quicker we can provide them the therapy, the quicker the patients will learn to accept the therapy, and they will overcome, or they can learn the technique at least to overcome it. So these are two stages here. Okay. Some of the disorders you can overcome with techniques, and some is quite hard to overcome it. And so it will based on the commit disorders that the patient has. So I don't have an exact number for you in that case. It will be based on the patient's characteristic. Okay.
All right, then. So that marks the end of the first session with Dr. Chu. Dr. Chu,
Thank you so
thank you
much.
so much for being a part of
Thank you
this
so
final session
much.
of the webinar. Thank you so
Thank
much.
you.
And hopefully in the
Thank you.
future, we'll still have this session and we hope we could call you in the future for another, maybe a
Definitely. My
workshop.
pleasure.
Definitely.
My pleasure. My pleasure. Thank you so much. Nice talking to you guys. Thank you.
Thank you so much. Thank you so much. And
Thank you.
thank you to the audience for your questions.
Thank
So now I will pass back to the MC, Julia.
That marks the end of our first session. I would like to remind all of you who have attended today's sessions but have not registered to do so by clicking on the link in our Instagram bio, because certificates will only be given to those who have registered. And after the short break, we'll continue the second session. So we're gonna get back to you about 5 minutes. Welcome back, everyone. We are glad you're still with us. Let me introduce the second and the last speaker for today, Dr. Saravana. Dr. Saravana's talk today is titled Role of Organic Chemistry in Illicit Drug Analysis.
Let's welcome Dr. Saravana to the broadcast.
Hello.
Hello, Dr. Sarah.
Hi, how
Welcome
are you?
to
Thank you.
IMW, the virtual IMW.
Thank you.
Welcome.
Thank you for having me here.
We're very happy to have you here. And
Thank
Dr.
you.
Saravana, so your field is very interesting. Okay?
Thank you.
But the problem is right now there's many misconceptions about when we think about forensic, we always think about crime scene, CSI, CSI, CSI. But there's more to that than just
Correct.
a crime scene to forensics. So with
Correct.
that, I would like to pass the floor to you to explain
Okay.
to us the role of forensic chemistry in illicit drug analysis.
Sure. Thank you very much. Thank you very much. First of all, I would like to thank IMU for inviting me today to deliver this lecture. It's been an honor, and I would like to share with you some my slides today. Right. My talk today is actually the role of forensic chemistry in illicit drug analysis. My name is Saravana Kumar Jairam. I am from the Narcotics Division, Kimia, Malaysia. And this is a brief profile of myself. My name is Saravana Kumar Jairam. I'm 45 years old. My position is actually I'm a senior forensic chemist at the Narcotics Division, Kimia, Malaysia. My qualification is I have a PhD in forensic chemistry from the University of Strathclyde, United Kingdom. I also have another chemistry degree, which is my master's, which is from University Putra, Malaysia, which is in material chemistry. And finally, my undergraduate degree also from University Putra, Malaysia was on chemistry as well. So this is a very brief profile of myself. And as you can see on your left is me handling a GC-FTIR instrument, which is very, very beneficial in the analysis of illicit drug analysis in Malaysia. Okay. In Kimia, Malaysia, what we basically do, basically in the narcotics section, is that we analyze dangerous drugs. So dangerous drugs are drugs that has no therapeutic use, and what is being sent to us is usually from the Royal Malaysian Police, the Royal Malaysian Customs, and also sometimes from the Royal Armed Forces or ATM, Angkatan Tentera Malaysia. Right. On your screen right now, you can see various illicit drugs which we usually receive, and these are the popular ones in Malaysia at the moment. You can see from the picture there is methamphetamine or shabu, and the plant form on your top right is cannabis or ganja. And we also have drugs like heroin, cocaine, ecstasy, which comes in pill form. And then we have what we call newer drugs. We call them as new psychoactive substances. So what are these new psychoactive substances? These substances are actually not listed in our Dangerous Drug Act 1952. And these are what we call drugs which you can actually use it, but you won't get caught because it is not listed in our Dangerous Drug Act. So these are the newer drugs that we are getting. And some of these illicit drugs under the category of NPS, new psychoactive substance, are what we call synthetic tryptamines, are potent hallucinogens, and certain what drugs we call aryl cyclohexanamines, or what we call synthetic hallucinogens and synthetic cannabinoids. So these are some of the first slide is some of the drugs, the popular drugs that we receive in Jabatan Kimia and what we do for analysis as well. Okay, the next slide is actually besides analyzing dangerous drugs. Our role as forensic chemists is also to assist the Royal Malaysian Police in clandestine laboratory investigation. So what does that mean is actually we actually go to the crime scene pertaining to illicit drug synthesis. The pictures in front of you are pictures that I am sharing with you, which is highly confidential, which are some of the drug labs that we are called to investigate and to help the Royal Malaysian Police in their investigations as well. So our role as forensic chemists is we go to the crime scene, we analyze what's happening in the crime scene. At the same time, we advise the Royal Malaysian Police on what kinds of drugs are being synthesized or in synthesized in the crime scene, and how much of samples that the police need to send to us. Because sometimes when you go to an active crime scene, the reaction is still taking place, and if you turn off the heat or you turn off the vacuum or you turn off the fume hood, the whole place will be saturated with poisonous gases. So what we will do is we will advise the police and we will monitor the crime scene, and as need be, we will advise them what needs to be done and how to secure the crime scene. Besides that, we also do on-site screening where we take some samples and then we analyze on-site to determine if there's drugs present or precursors. And we also do sampling where sometimes the amount of drugs is just too much and all of it can't be sent to the lab. So what we'll do is we'll do some sampling and we will test the drugs and then we will inform the police accordingly to how much of samples that need to be sent to our department. Besides drugs and precursors, we also do sampling for essential chemicals. Okay, essential chemicals are basically chemicals that is used in the synthesis. And these are actually not drugs, but these are key ingredients that it's needed for the synthesis or for the cooking of drugs, illicit drugs in the crime scene itself. As you can see on the top middle picture, chemists from Jabatan Kimia Malaysia are actively taking samples and taking down notes. And the other pictures are, this is actually a factory in Semenyih way back, where they were using this soap factory to synthesize illicit drugs. And the pictures you can see on your far right and far right below are some of the vessels and some of the apparatus used in the illicit synthesis of drugs. Okay, what's a clandestine laboratory investigation? So usually it's what we call before, during, and after the raid. Okay, before the raid is what happens when they provide evidence during initial investigation, such as background information, safety, and we will give recommendations to the police what needs to be done. And if there's an active crime scene, there is actually heat and cooking is involved, we will advise the police accordingly what needs to be done and how to make the crime scene more secure. Okay, during the raid, this is done by the police. We will tell them to assess the danger, assist with the seizure and sampling, and advise them on submissions of evidence. Because sometimes some crime scene we do not get to go. So what we will do is during the raid, we will just inform the police that there's dangers involved in hazardous chemicals, and how the best police can secure the crime scene and not endanger themselves by opening large quantities of essential chemicals, which is very harmful. Once you open it, if you inhale all these chemicals, you might lead to poisoning, and you can even die during the crime scene. Okay, after the raid is very important. This is something that we are usually involved in, and this is where we do chemical analysis. Court testimony is when we do attend courts. The chemical analysis that we do on site is very important, and we need to testify and tell the judge what's actually going on. And also, we also can provide information on yields, production potentials, methods, and other requirements. So what this means is that we can basically back calculate from the amount of chemicals present, how much drugs that can be synthesized. Meaning that the drugs may not be synthesized yet. By looking at the amount of precursors or ingredients that are on the scene, we can actually calculate the yields and we can inform the police. So this is a theoretical yield, and if this lab was successful in synthesis, This is the amount of drugs that they can actually produce. Okay, these are some of the newer drugs on scene. During the questionnaire, I noticed that some of you asked about synthetic hallucinogens and types of different drugs which are present. So the NPS, which is the new psychoactive substances, some of the hallucinogens, we call them as tryptamines. They usually come in this new NPS. And these are a range of drugs that are being designed to mimic established drugs. So what it basically means is that these drugs are not listed. We call them as legal highs. And these drugs, what happens is that if you do get caught with it, sometimes the police only can charge you with a fine. And these drugs are very well established in the international market. And its potency is much higher than some of the common drugs that we receive. For example, like cocaine, ecstasy, and LSD. So most of the syndicates, what they do is they don't know the amount of purity which they put inside their substances. So when the user takes the drugs, sometimes they can even overdose. So these are the newer drugs in the scene, and we have been receiving this since 2012 and 2019. 2020, we are seeing some of it, but it's because it's still July, so we expect to see more of it coming through to the year end. Okay, these are some of the examples. As you can see, some of these drugs comes in pill form, and then we also have some that looks like potpourri, so they can actually boil it as tea and drink it. And some comes in white powder, and some they even comes as stamps. So what they do is they will take the stamp and they will just put it onto their skin, and the drugs is absorbed through the skin. And sometimes the stamps also they can put it underneath their tongues. So these are some of the newer drugs that is out there at the moment, and these are very, very dangerous, because if you don't know the purity and how much your tolerance is, sometimes there are cases where people have overdosed and died from taking these drugs. Okay, besides that, in Jabatan Kimia, we also have state-of-the-art instruments. Okay, besides instruments that we use routinely, we also employ state-of-the-art instruments for drugs that, what do you call the newer drugs, for example, like the NPS, the new psychoactive substance. So for this particular kind of drugs, we need to use more high-end instruments, because the regular instruments does not discriminate. And in the drugs itself, we have what you call many isomers. Isomers is meaning is that something which is similar but not same. And for the discrimination of these kinds of drugs, we need to use more high-end instruments. And in Jabatan Kimia, we employ many high-end instruments to do our analysis, when our routine instruments cannot positively identify these drugs when we receive them. So some of the instruments that we use is on your far left is what you call a GCFTIR, and then on your right is what you call the NMR, in nuclear magnetic resonance. On your below left is what we call the IRMS, which is the isotope ratio mass spectrometry, where we will do analysis based on isotope fingerprints. And on your right, we have the LC-MS-MS, which is the tandem MS, and it's what we call the Rolls-Royce of drug analysis, where this particular instrument costs us about 1.3 million. So these are some of the important and state-of-the-art instruments that we use in our drug analysis. Okay, what are the expertise and what is the role of forensic chemistry in illicit drugs? Okay, we have in Jabatan Kimia at the present moment expertise in synthetic organic chemistry. So what does that mean is that we have theoretical knowledge and also practical knowledge on how the drugs have been made. So we know how the drugs have been manufactured and how the synthesis takes place. Besides that, we also have analytical chemistry knowledge, as I explained to you earlier, using state-of-the-art instruments. That is all analytical, and we need this instrument to positively identify what are the drugs present and what types of drugs. Besides that, we also have expert knowledge in illicit drug chemistry pertaining to clandestine laboratory investigation. What it means is that we can link precursors to high-end products, as I mentioned earlier, where We sometimes there's no drugs on the scene, but based on the chemicals and based on the essential ingredients which are in the crime scene, we can actually advise the police on what type of drugs that would be manufactured if this lab was successful in their endeavors. Besides that, we have knowledge in world drug trends. Okay, knowledge in world drug trends meaning is like, for example, for like the new drugs which I explained earlier, which is the NPS. So sometimes we see trends happening in other countries. For instance, our closest neighbor like Indonesia, Thailand, Singapore, and then we have countries like Vietnam. So we will also monitor drug trends over there and see what kinds of drugs are coming in, and then we can basically assess what's going to happen if these drugs come into our shores through our borders. So besides that, the role of forensic chemist in illicit drug analysis is also we need to present ourselves as expert witness. Basically, when you attend a crime scene or when you do high-end analysis on high-profile cases, you will be called to give evidence as an expert witness. If it's the trafficking case, which is the death penalty. So you will present yourself in the high courts and give your evidence in front of the high court judge, and they will ask your opinion on what kind of analysis that you have done and how you came about in your conclusions and what kind of instruments that you use. So these are some of the roles which is very important for forensic chemists in drug analysis. Besides that, we also have adjunct teaching positions, and we are also field supervisors for local higher learning institutions like, for example, USM, UTM, UITM. So these are some of the local institutions that we teach, and undergraduates doing their forensic chemistry degree come to us for placements. Besides that, we also have teaching positions in foreign universities like in Thailand, and where we also present ourselves, and we use our casework experience to teach students pursuing a postgraduate degree like masters and PhD. Besides that, we also, from our casework experience, we put in oral abstracts, and we also publish in local and international journals. And we have also, in the narcotics sections, we have presented in the American Academy of Forensic Sciences, also in the European Academy of Forensic Sciences and International Academy of Forensic Sciences. So this platform is very important for us because not only we network with other international chemists and forensic scientists, we also can study from them the latest trends, new analytical instruments, and some theoretical knowledge on how the drugs synthesize and how they go about using and different analytical instruments, method developments. So these are some of the roles that you need to equip yourself for you to stay relevant, and at the same time, which helps you in identifying and analysis of many forensic chemistry cases in the country. Okay, besides all of that, we also do illicit drug research. This is with industry. So this is a research that I'm currently involved in, and this is what we call platform sharing avenue with Jabatan Kimia and scientific precision instrument makers. Okay, this instrument maker is actually Shimadzu Malaysia, and we were actually engaging with their experts to develop methods with the latest state-of-the-art instrument. The instrument you see in this presentation is actually the direct probe ionization mass spec, and the expert on your far left is Dr. Udi. So myself and Dr. Udi were actually developing methods in the analysis of illicit drugs. This instrument is currently still being manufactured, but they were just testing out the instrument with industry to see its feasibility and how we can best use this because it's a more robust instrument, and it can be used for a shorter turnaround time, meaning the analysis is much faster and there's less sample prep. So this is some of the research avenues that forensic chemists in the narcotics division that we use to share with you today. Besides that, these are some of the examples of high-profile cases that we solve in the country. These are some of the newspaper cuttings, drugs that are worth millions of dollars, and they are smuggled in using various receptacles. For example, in pill bottles, in furniture, and we also have some coming through machineries, and also some drugs are smuggled as hair attachments. So these are some of the cases that we receive. At the same time, this is seizures done by the police and Royal Malaysian Customs. Sometimes, if the amount of drugs is just very big amounts, we go into a system in the sampling, and then later when the samples are sent to us, we will do the analysis using our instruments, and we will produce reports pertaining to the analysis, which the police and the Royal Malaysian Customs will forward to the Attorney General chambers, and they will prosecute the perpetrators. Okay, tools. Okay, these are for future forensic chemists. So what are the qualifications needed for you to pursue a degree, or a career in forensic chemistry? So basically what you need is a good undergraduate degree in pure science. If it's pertaining to forensic chemistry, a pure science degree in chemistry or biochemistry. If you're going to do something in biology, you can focus on a pure science biology and microbiology degree. Okay, if you're going to do something with applied chemistry, you can always do an analytical chemistry degree. There's also many various institutions that offer a degree in forensic science, emphasis in chemistry, where you can major in forensic chemistry. Besides that, you also, after getting your undergraduate degree, you can do a postgraduate degree, which is a master's or a PhD. In that postgraduate degree, you can specialize in, for example, illicit drug synthesis, drug profiling, and also research pertaining using a lot of state-of-the-art instruments. Okay, forensic science in Malaysia, Jabatan Kimia Malaysia, and its center, which is a Center for Forensic Science, is the lead agency where we, besides doing analysis on illicit drugs, we also do analysis on DNA, crime scene, and then we also have criminalistic section. We also do work on toxicology, and there's also document examination. So these are some of the centers which we have in the Center for Forensic Science. And Kimia Malaysia is actually an ADNAP accredited body, which is the ANCI National Accredited Body. And the ANCI actually stands for the American National Standards Institute. So we are accredited by an international body, and our testing, our reports, and the instrumentation that we use is world class. And our reports, when it's submitted, we can submit it with confidence because we follow the highest level of quality. Besides that, we also have ISO 17025, and we, as I mentioned earlier, we are the lead agency, and we do analysis on samples not only pertaining to drugs but crime scene like rape, murder, toxicology, and criminalistics, which we submitted by PDRM, ATM, the Royal Malaysian Customs. That is all for my presentation today. Thank you for your attention.
Thank you so much, Dr.
And I hope that this talk was useful and beneficial for the general public, general audience. Thank you.
Thank you. So, Dr. Sarah, so before
Yes.
I pass the floor to the audience for the Q&A, we have quite a number of questions from the audience. Very interesting questions.
Very good. Okay.
But before we pass the Q&A to them, I like to be a little bit selfish and ask questions from what I want to know.
Okay,
so it was quite surprising when you mentioned about the Drug Act, where all this newer drug is not included. So if you'll be caught with it, the list that you'll be going through is just a fine.
Yes, correct.
So is there any plans of updating this to add all these new drugs in future drug acts?
Very good question. Yeah. Yes, as we find newer drugs present in the Malaysian scenario or Malaysian context, what we'll do is we will advise the Attorney General's, and then what they will do is they'll bring it up in a meeting, and they will next will discuss with the pharmacy board, and they will proceed to put it in first in the Poison Act, and after it gets through Parliament, it will be pushed on to the Dangerous Drug Act, which is the ADB 1952. So it is all upon advice, because sometimes the government doesn't know what's actually out there. And we being one of the first agencies to actually find these newer drugs coming into the market. So we will advise the relevant authorities accordingly, and also we will let them know the dangers of these drugs and how best we can educate the public and the law enforcement personnel as well.
Okay. And another question, which echoes one of our audience's question. So since
Yes.
all these newer drugs are not in the Drug Act, so
Okay.
if it's found in a crime scene, what will happen
Okay.
to that drug? Is it being disposed of or stored somewhere?
Okay, what happens is that the police will send the samples to us. We will use it for analysis. Once we have finished the analysis, we will return the drugs back to the police with the report. And after the case goes through court cases, I mean, we have to present ourselves and then identify in court, is this the drug that you receive? Is this the samples that you analyze? Once you have gone through the whole judiciary process, what happens is that the police then will take and destroy the drugs. And sometimes we are present as well, because the police will ask us how is best for us to dispose of it, and what are the methods you suggest for us to dispose the drugs. So usually after everything, the drugs are disposed.
Okay. There's a very constant communication between the police and the forensic scientist.
Yes, correct.
And that leads us to another, I would say, a fun question, but it's an
Okay.
inevitable question about CSI.
Okay.
So, as one scientist, as a forensic chemist from the field itself, and has been watching CSI, what are the myths that they show on screen that's totally different than what actually happens in real life?
Okay, the CSI effect is something that we get asked frequently, and it's a very common question, because when students look at, some of the analysis that we do is not wrong. The instrumentation is sometimes correct. They use a GCMS, which is a very popular instrument, but sometimes you just can't take something, just put it into a vial and stick it into a GC and get the results like hocus pocus. Because there's a lot of what you call sample prep. We need to study the background of samples. And sometimes when you do get a hit, it's not a positive hit. Sometimes it's very diluted. And we need to work on the samples. We need to clean the samples. So there's a lot of wet chemistry, and there's a lot of sample prep that we need to do before we can actually put it into the GC. One of the common fun fact that CSI is that they come in and then they take everything, they stick it into a vial, and they put it inside the GC, and then they can get pop. So some certain samples, not everything can be analyzed using the GC. We need other equipments as well, and experience in sample prep for us before we can actually put it and get a positive hit.
Okay. Thank you, Doctor.
Very welcome.
Now I'll pass the session to the MC to deliver to start the Q&A session.
Sure.
Thank you, Dr. Saravana and Mr. Nick, for the very informational session. I'm also quite surprised that, as you say, the newest drugs, if police will catch the user or the deliverer, right, they wouldn't get any fine, right? So,
yes.
But the most interesting thing that actually is personally I heard and know and saw that this drugs is the most dangerous one, because you never know what's inside the drug. The users basically don't know the dose, what kind of dose they're supposed to take. So basically most of the times is overdose happening. So these drugs, it's really scary and really, really dangerous. But anyway, next we're gonna have a Q&A session. We're gonna continue it.
Sure.
And while we shall leave the questions to be forwarded to you, Dr. Sarwana,
Sure.
we're gonna be right back, like in 2 minutes.
Sure.
So let's continue our Q&A session. Do you think legalization will prevent overdose cases? Statistics in Canada and Netherlands shows post-over results after legalizing. Positive! Showing positive results after legalizing marijuana.
Yes, I mean, it's a good question. Legalization sometimes it's got its pros and cons. Many countries we have seen abroad that when they do legalize certain drugs, not all, because like for example, marijuana has therapeutic use,
Yeah.
and many countries are legalizing marijuana, but with strict what do you call prescriptions.
Restrictions,
And,
yeah.
yes, and you need pharmacists, and then you need doctors on board, which can actually prescribe marijuana. So marijuana is different because the drugs itself, it's got therapeutic use. So by legalizing it and for putting a legal framework onto the drugs, and we have professional medical professionals like doctors and pharmacists on board, and they can prescribe. I think it's a good idea because in instances where research has shown that marijuana can be used to treat cancer, we can use it to treat PTSD. There are cases where they can even use to treat depression. So there is what we call a huge response for even in the country for us to legalize marijuana, but we do not have a proper legal framework in place for us to actually to determine if it's medical grade or is it used for illicit use. So that is something which can deter a lot of negative impact on the drugs itself. But there are certain drugs that we can't legalize. For example, like methamphetamine, for heroin. So these kind of drugs you can't legalize because there's no therapeutic use. And when the user takes it, it's got no use and there's high tolerance for addiction. So for drugs like that, I don't think any country will legalize. But like for drugs, for marijuana and all that, yes. I mean, with a proper legal framework and with other medical professionals on board, I think it should be well regulated and it can be used for therapeutic use.
Sir, what will you say about LSD? Because like since LSD was created and opened and
Yes.
synthesized by the scientist, I forgot
Yes,
his
Albert
name,
Hoffman. Yes.
German
Yes.
scientist, right?
Swiss German scientist Albert
Yeah,
Hoffman. Dr. Albert
yeah,
Hoffman.
yeah,
Yes.
yeah.
Yes.
He actually firstly he was using LSD for like also for depression or
Correct.
kind of disease like that. So what do
Yeah.
you say about the LSD?
Okay. LSD. It can be used for to get high because it's a what you call a potent hallucinogen.
Yeah.
When you talk about hallucinogens, there's a lot of things that can happen to your brain chemistry. And when Dr. Albert Hoffman started off his research and producing LSD, it was wanted to be used for many things. And
Mm,
recent studies seen that it can be used for treatment for depression, but again, we need to do human trials. The drug needs to be brought in.
of course,
Maybe we
yes.
can see how the other countries are going about doing it. So in Malaysia, LSD is still classed as a class one drug, and
The most
yeah, yes,
dangerous, right? Yeah.
dangerous drug. So if you're caught having these drugs on you, you can be charged. So if in the future the government and the NGOs out there, and we see how the human trials, how it goes. If there is a proper legal framework saying that, look, this dosage is allowed and this dosage is not allowed, we can help. But for now, it is still a class one drug.
I see. Okay. The next question will be since then the newer drugs are more much chemically complex than the others, could it be possible that every scientists are involved in drug making industry? I think
Yes.
so. I think so actually.
Yes, it is. To to answer that question, we do meet and chat with many of the clandestine chemists that are caught in some of the labs, mainly from Taiwan, and many
Oh,
of them have PhDs and masters in chemistry. Some of them
oh.
have 3, 4 degrees in organic chemistry. I have personally interviewed some of them because as chemists we speak our own language,
Mm-hmm.
and when a common person speaks to them, like for instance someone who's not trained in the field, you might not understand what he's saying. So yes, many scientists, especially chemists, are actually involved in the illicit drug industry. One, because it's a quite lucrative industry, and if you're successful in actually synthesizing, let's say, the newer drugs, the new
Mm-hmm.
psychoactive substances, and you can market them as legal highs, and the syndicates get very excited because they know for a fact that the effect on that person, the drugs they give you is what is wanted, and at the same time they won't get caught. So yes, the newer ones are very chemically quite complex, and these are the class of drugs which I explained earlier, which are the new psychoactive substances. And yes, it is being synthesized, and the chemistry of it is done by professionals.
I see.
Yeah.
Yeah. All right. And last questions. The last question gonna be people are saying that smoking should be illegalized due to its harm and instead marijuana should be legalized due to its positive effects. What do you think about it?
Yes, smoking is if you were to read the World Drug Report, I mean there are two most what you call legal drugs out there, which is smoking, cigarettes,
Alcohol and
alcohol.
cigarettes. Yes,
So
exactly.
these two, I mean, it's a tough question. I mean, and everybody knows that it is harmful, but people can still take it and function, and probably there is what we call a limit. And when you do smoke a lot, the disease that you get, maybe cancers, maybe 10, 15, 20 years, you're not going to die immediately, but there is what you call after effect. But for dangerous drugs, for instance, like what I meant, like NPS, the new second, you can overdose immediately.
Yes.
So the potential harm for it to happen immediately is always there. So hence why, and these industries like alcohol and tobacco are very, very big industries, and they also contribute a lot to economies to many, many countries. And at the same time, it's up to the user to limit him or herself on how much you want to take. So of course, when you go above your tolerance, I mean, you can talk to any doctor or pharmacist. I mean, your body wants more. Alcohol, for instance, when you drink, there's a certain limit, and then you can go on and on and on until you get drunk. And so all of this is a compounding effect in your body, and it's very,
Addiction.
very important for you to know your limits and at the same time control yourself. So you can do that for alcohol, and you can do that for tobacco. But for drugs, like for instance heroin, there's no U-turn. I mean, that means once you start on it,
Yeah,
you're
you
hooked.
cannot stop anymore.
Yeah, you can't stop anymore, and there's no U-turn. There's certain drugs that you can try, but I'm not advising you guys to try them. But this is what you call gateway drugs, like for instance ecstasy,
Yeah,
cannabis. So these are the drugs
cocaine
when
as well.
for fun, you take a
Yeah.
puff. It's okay. Ecstasy, you pop one in, you feel good, you want to dance and stuff. Okay, it's fine. But drugs like methamphetamine, drugs like cocaine, drugs like heroin, once you take it, you're hooked. So, it immediately builds a tolerance in you and you want more. So hence why, these drugs are what you call very, very dangerous. And hence why it's listed in our dangerous drug act. I hope I answer your question.
Yes, yes, you are. Thank you so much.
Very welcome.
So, thank you so much, Dr. Sarwana. It was so nice to having you today with us.
Thank you for having me, because it's been a real pleasure to talk to young minds. And I hope after my talk today, many of you will be interested in the career in forensic chemistry, because it's what you call a rewarding career, in the sense that you're doing your part to put a stop to many negative influences that are coming into our countries and through our shores, or maybe wherever you have come from, many, many countries abroad. So we're doing our part to stop these negative elements coming into our community and helping the enforcement as well. Thank you. Thank you very much for having me.
Thank you so much, sir. I'm sure a lot of people now will be interested in chemistry, in drug synthesis as well, but like in this way, safe way to prevent. So yes, that marks the end of our second session and subsequently our webinar today. I would like to remind to all of you who have attended today's session but have not registered yet to do so. To register, you can go straight forward to our Instagram page and just click the link and register.
Okay, thank you so much, Julia. So when Dr. Sarah said there were some drugs that you can try, I saw Julia's face lit up. Okay, so please don't try drugs, kids. Okay, or anyone else. Please don't try drugs. Okay. So now, before we end our session, I would like to take a group photo with all the speakers and also our MC today. So can we invite the three of them on the screen right now?
Hi.
Hello.
Hi.
Hello.
You're a happy family. So let's take a picture together. So I'll count down from 3, then my committee will just screenshot screen.
Yep, sure.
Okay. So 3, 2, 1. All right.
Thank you.
Cool.
Thank you so much.
Thank you so much.
All right. Thank you so much, Dr. Sarah. Thank you so
Great.
much, Dr. Chu. But before we end,
Thank you.
I'd like to ask if there's any way for our viewers to communicate with you or to ask any further questions. Where do they contact
Sure.
you? Let's start with
Sure.
Dr. Chu first. Yeah.
Our
Where can they get in
email?
touch with you? Email.
Yes, they can contact us with our email. Is that okay?
Okay. So your email is, I'll put it on the screen right now.
I will I type it for you on the private chat, so you can just
Okay.
copy and paste.
Sure.
That's my private email as well. So if you need any questions related to illicit drug synthesis or anything in forensic chemistry, or you need me to be present again, any talks, I'm always available.
Definitely. Thank you so much again.
Thank you.
So can we
Okay.
share Dr. Sarah's email on the screen? Okay, great. Thank you so much again, Dr. Chu and Dr. Saravana, for a very, I would say,
Thank
a
you.
very engaged and fruitful session. So I hope for future collaboration between IUMW and UKM and the Department of Chemistry in the future. Thank you so much. Have a nice day, everyone.
Thank you.
Thank you.
Thank you.
Thanks for having
Bye.
us. Thank you. Bye bye.
Bye
Our
bye.
pleasure. Bye-bye. Thank you, everyone.